Have you ever sat on the toilet with a strong feeling that you need to have a bowel movement, only to find that almost nothing comes out? You wait, you try again, you strain a little harder, and still it feels as though something is blocking the way. For many people, especially after the age of 50, the first thought is simply, "I'm constipated," and sometimes that is exactly what is happening. But there's another possibility that deserves to be understood because the approach can be very different. Sometimes stool becomes so hard, dry, and compacted that it becomes difficult to move through the rectum. This is known as fecal impaction. In simple terms, a mass of stool becomes trapped in the lower part of the digestive tract and may become increasingly difficult to pass normally. Now, this does not mean every episode of constipation is dangerous. Constipation is common and can happen because of changes in diet, fluids, activity, medications, or daily routine. But when stool remains trapped and symptoms continue, you should not simply keep straining and hoping the problem will disappear. There is also a confusing part that many people do not know about. You may still feel the urge to go. You may pass a small amount of stool. In some situations, you may even notice watery stool or leakage. That can make you think the problem is finally resolving when it may not be. So today, we're going to explain what stool stuck in the rectum actually means, the 7 warning signs you should pay attention to, the mistakes people commonly make, why adults over the 50th of may be more vulnerable, and what steps can help you respond appropriately. The goal is not to frighten you. It is to help you recognize a problem early and know when professional medical attention is appropriate. But before we discuss those warning signs, it helps to understand what is actually happening inside your body. Think of the digestive tract as a long moving pathway. Food travels through your stomach and intestines, water is gradually absorbed, and eventually the remaining material becomes stool. The rectum acts as a temporary storage area before a bowel movement. Normally, when stool reaches the rectum, your body sends signals telling you it is time to go. The muscles around the rectum then coordinate with the muscles of your abdomen and pelvic floor to help move the stool out. When stool remains in the colon or rectum for too long, more water can be removed from it, making it harder and drier. Imagine a soft lump of clay that is left exposed to air for several days. It gradually becomes firmer and less flexible. Stool can become similarly difficult to move when it becomes very dry and compacted. That is one reason constipation can sometimes become a cycle. You feel the urge to go, but passing stool is difficult, so you strain. The bowel movement may be incomplete, leaving more stool behind. Then you may become uncomfortable and begin avoiding the bathroom because you expect another difficult experience. Over time, the situation can become more frustrating. But here is an important distinction. Ordinary constipation and fecal impaction are not exactly the same thing. With ordinary constipation, bowel movements may be less frequent, harder, or more difficult than usual, but stool can often still pass. With fecal impaction, stool has become firmly retained and may be very difficult or impossible to pass normally. Only a healthcare professional can determine what is actually happening in a particular person. That is why the symptoms matter, especially when several appear together. The first warning sign is one many people recognize immediately. You have a strong urge to have a bowel movement, but very little comes out. You may sit on the toilet expecting relief, only to pass a few small pieces. Then, shortly afterward, you feel that you still need to go. This repeated cycle can be frustrating. You may think the solution is to push harder, but excessive straining is not a good long-term strategy. It can increase discomfort and may contribute to problems such as hemorrhoids. If you repeatedly feel blocked, especially when this is unusual for you, or continues despite your normal efforts, it is worth paying attention to the pattern rather than simply forcing another bowel movement. The second warning sign is particularly confusing: watery stool or leakage. Many people hear the word diarrhea and immediately assume that whatever was stuck has finally moved. But watery material does not always mean the underlying problem has disappeared. When harder stool is retained, liquid stool may sometimes pass around it. This can create loose or watery bowel movements or leakage. Imagine a large object partially blocking a pipe. Water may find a narrow path around the obstruction while the main blockage remains in place. The human digestive system is more complicated than a pipe, of course, but the analogy helps explain why watery stool does not automatically rule out retained stool. This is especially important if watery stool occurs alongside a feeling of incomplete emptying, abdominal discomfort, or ongoing constipation. Do not assume every episode of diarrhea means fecal impaction, because there are many causes of diarrhea. The point is simply that the overall pattern matters. The third warning sign is pressure, fullness, or discomfort in the rectal area. Some people describe it as feeling as though there is still something there even after they have tried to have a bowel movement. Others may notice pressure when sitting or an uncomfortable sensation that keeps returning. This can happen because stool remaining in the rectum can stretch the area and create persistent signals that you need to go. Again, mild discomfort does not automatically mean there is an impaction, but persistent or worsening symptoms should not be ignored. And if pain becomes severe, sudden, or is accompanied by other concerning symptoms, that is a reason to seek medical evaluation rather than continuing to experiment with home remedies. The fourth warning sign can appear farther up in the abdomen: bloating, abdominal discomfort, or cramping. When stool is moving slowly through the digestive tract, people may feel unusually full, bloated, or uncomfortable. You might notice that your abdomen feels different from normal, especially when the change occurs together with several days of constipation. Sometimes people blame this entirely on a meal or something they ate. Food can certainly cause bloating, but persistent abdominal symptoms combined with significant constipation deserve more attention. The important thing is to look at the whole picture. Mild occasional bloating is common. Severe, worsening, or persistent abdominal symptoms are different. If abdominal pain becomes intense, your abdomen becomes increasingly swollen, or you develop vomiting or other serious symptoms, you should seek prompt medical care. Now we come to the fifth warning sign: a noticeable loss of appetite or feeling unusually full. When your digestive system is uncomfortable, you may simply not feel like eating. A person who normally enjoys breakfast may suddenly feel full after only a few bites. They may say, "I just don't feel hungry." Again, this symptom has many possible causes, so it does not prove that stool is impacted. But when appetite changes appear together with ongoing constipation, bloating, pressure, or difficulty passing stool, they become more meaningful. The sixth warning sign is nausea or vomiting. This is one of the symptoms that should make you more cautious, particularly when it occurs with significant abdominal discomfort or an inability to have a bowel movement. Nausea can happen for countless reasons, including infections, medications, food-related problems, and many other conditions. But when it appears as part of a worsening digestive problem, it should not simply be dismissed. The seventh warning sign is an inability to pass stool or gas, particularly when this occurs with significant pain, abdominal swelling, vomiting, or a general feeling that you are becoming seriously unwell. This is where it becomes especially important not to rely on online information to diagnose yourself. A person may have severe constipation, fecal impaction, or another condition requiring medical assessment. The symptoms can overlap. That is why the safest approach is to recognize red flags and seek professional evaluation when they appear. So, how do you separate an ordinary bout of constipation from something that deserves medical attention? Think about the pattern rather than one isolated symptom. If you simply have a harder bowel movement than usual after a change in diet or routine, and you otherwise feel well, that may be ordinary constipation. But if you repeatedly feel blocked, cannot pass stool normally, develop persistent abdominal discomfort, experience watery leakage around a feeling of blockage, or develop vomiting, severe pain, swelling, bleeding, or an inability to pass stool or gas, the situation deserves more attention. Another important question is why this happens more often in some adults over 50. Aging itself does not mean you are destined to become constipated, but several factors that become more common with age can increase the risk. Some people become less physically active. Others drink less fluid because they do not feel thirsty as often or because they intentionally limit fluids. Dietary habits can change. Some people eat fewer fiber-rich foods. Certain medications can also contribute to constipation, including some medicines used for pain and other health conditions. Mobility problems can make getting to the bathroom difficult, while busy routines or embarrassment can cause people to repeatedly ignore the urge to go. Over time, these factors can work together. That is why prevention is not about finding one magical food or one perfect bathroom trick. It is about supporting normal bowel function consistently. Now, there are also several mistakes people make when they feel stool is stuck. The first is repeatedly straining harder. If the stool is very hard or impacted, simply pushing with more force may not solve the underlying problem. The second mistake is ignoring symptoms because they feel embarrassing. Constipation and bowel problems are extremely common, and healthcare professionals discuss them every day. Embarrassment should never stop you from asking for help when symptoms are persistent or severe. The third mistake is taking random medications without understanding what is happening. Different constipation treatments work in different ways, and some situations require professional assessment. If you take prescription medications regularly, do not stop them on your own because you suspect they are causing constipation. Instead, ask your healthcare professional whether an alternative or adjustment is appropriate. The fourth mistake is assuming watery stool means the problem is definitely over. As we discussed earlier, liquid stool can sometimes pass around retained stool. And the fifth mistake is waiting too long despite worsening symptoms. If your pain is increasing, you are vomiting, your abdomen is becoming swollen, you are bleeding, or you cannot pass stool or gas and feel increasingly unwell, that is not the time to simply keep trying home remedies. You need appropriate medical evaluation. So what should you do if you genuinely suspect stool is stuck? First, stay calm. Do not panic. Pay attention to what your body is telling you. If symptoms are mild and consistent with ordinary constipation, lifestyle measures such as adequate fluid intake, gradually increasing fiber when appropriate, regular physical activity, and responding to the urge to have a bowel movement may help support regular bowel function. But suspected fecal impaction is different. A healthcare professional may need to evaluate you and determine the safest treatment. Depending on the situation, treatment may involve medications, rectal treatments, or removal of retained stool by a healthcare professional. The right approach depends on the individual and should not be assumed from a video. Most importantly, severe abdominal pain, repeated vomiting, significant abdominal swelling, rectal bleeding, fever with concerning symptoms, fainting, severe weakness, or inability to pass stool or gas should prompt urgent medical attention. These symptoms can occur with conditions other than fecal impaction, some of which require rapid treatment. Once the immediate problem has been addressed, prevention becomes the next goal. One of the simplest foundations is maintaining adequate fluid intake. Unless a healthcare professional has told you to restrict fluids because of another medical condition. Fiber can also support regular bowel movements, but increase it gradually and make sure you are drinking enough fluid. Good sources include vegetables, fruits, beans, whole grains, and other fiber-rich foods. Physical activity can also help support normal bowel function. You do not need an extreme workout. Regular walking and movement may be useful depending on your abilities. Another helpful habit is not repeatedly ignoring the urge to have a bowel movement. Your body is giving you a signal for a reason. Creating a regular, unhurried bathroom routine may also help some people. And if constipation keeps returning, do not simply keep treating the symptom without asking why. Review your medications with your healthcare professional, consider changes in diet and activity, and discuss persistent bowel changes. Now let's put everything together. Stool that feels stuck is not always an emergency, and constipation is common, but persistent blockage, repeated incomplete bowel movements, watery leakage, rectal pressure, abdominal discomfort, appetite changes, nausea or vomiting, and inability to pass stool or gas can be important warning signs. The key is not to become frightened by one symptom. The key is to recognize a concerning pattern and respond appropriately. Your digestive system is communicating with you all the time. When you listen early, you have a better chance of getting the right help before a manageable problem becomes much more difficult. And if you know someone over 50 who frequently struggles with constipation, share this information with them. Sometimes the most useful health advice is simply knowing which symptoms should not be ignored. And in the next part of your health journey, remember this: you do not have to be embarrassed about bowel health. Understanding what is normal, recognizing what has changed, and knowing when to ask a healthcare professional for help are all important parts of taking care of yourself as you age.